Hello, I was reading this article that people might find interesting. A joint report by the U.S. Center of Disease Control and Prevention (CDC) and the Food Drug Administration (the FDA) revealed that lethal heroin overdose nearly quadrupled between 2000 and 2013. Between 2000 and 2010, heroin-related deaths rose at an average rate of 6% per year. Then from 2010 to 2013, the average annual increase steadily jumped to 37%. According to a CDC director, opioid painkillers like Vicodin and Oxycontin increased your susceptibility to heroin addiction, and the vast report of the majority, around 75% of the study of known heroin users, started out on prescription painkillers. Prescriptions for opioid-based painkillers have risen by a staggering 300% over the past decade. As of 2012, 259 million prescriptions for opioids and other narcotic painkillers were written in the U.S. The trend of painkiller abuse has also been seen in the death rates linked to overdose from prescription painkillers, which rose 350% among men and 500% among women in the decade between 1999 and 2010. There were 4 times more deaths from prescription painkillers among women than for cocaine, heroin combined in 2010. Now, this is interesting since heroin usage rate has increased across the board among both sexes in all age groups and income levels, but some of the largest increases of groups that have historically had low rates of heroin use, and one of those groups that's interesting is middle class and upper class women using heroin. Among women, heroin use has doubled in the past decade. Heroin use also rose by 60% among those with an annual income of $50,000 and by 62.5% among people with private insurance. Multiple drug addiction is also common. 96% of heroin users use at least one other drug, including prescription painkillers, cocaine, marijuana, and alcohol. According to the Drug Enforcement Administration, the DEA, one-day supply of Oxycontin on the street can cost as much as $160, while a day's worth of heroin costs around $40. There are also some people that also turn to heroin when they can no longer get their prescriptions refilled or when their tolerance level surpasses their allotted prescription dosage. The Atlantic recently discussed the phenomena of the rising heroin use among women, noting that gender difference can make, noting that gender differences could make getting hooked on painkillers a riskier proposition for women than men. Women tend to become more dependent on drugs more quickly than men, according to the most recent data from the Substance Abuse Mental Health Services Administration. This is especially shocking when the case among those who abuse alcohol, marijuana, and opiates like heroin. Women also find it harder to quit and can be more susceptible than men to relapse, according to the Harvard Medical School. Well, this sounds right to me, since it is well documented that women utilize the mainstream healthcare system the United States more than men. A 2013 study identified 3 factors that are predictions of increased risk of painkiller dependence. 1. Frequency of painkiller use, history of substance abuse, often unrelated to pain relief, and the last, reduced ability to cope with pain. According to the authors of this study, based on these findings, a preliminary model is presented with 3 types of influences of that. According to the authors of the study, the second and third items may reveal some of the underlying mechanisms that place women at an increased rate of heroin abuse. In summary, a lethal heroin overdose nearly quadrupled between 2000 and 2013 in the United States. The largest increase are seen in groups that had historically low rates of heroin use but high rates of painkiller, most notably women, the privately insured, and those in higher income brackets. And lastly, women tend to become more dependent on drugs more rapidly than men. Women also tend to have a harder time quitting and are more susceptible to men than relapsing. Personally, I agree that the mainstream medicine tends to overprescribe these types of medications, and there are other solutions than painkillers, or there needs to be a combination of the natural holistic therapies with using these types of medications. Some known additional recommendations of most effective non-drug alternatives for the treatment of various types of pain. If you're in pain, then prescription painkillers should be the last result, or used in a combination between these holistic therapies. 1. Eliminate or radically reduce processed foods. Avoiding processed grains and refined sugars, mainly fructose, will lower your insulin and leptin levels and decrease insulin and leptin resistance, which is the most important reasons why inflammation is produced. That is why stopping sugar and sweets is so important to controlling your pain and types of chronic illness. 2. Emotional freedom technique, or EFT. EFT is a drug-free approach for pain management of all kinds. It borrows from the principles of acupuncture in that it helps you balance out your subtle energy system. It helps resolve underlying other subconscious negative emotions that may be exaggerated with your physical pain by stimulating, tapping well-established acupuncture points with your fingertips. And third, one of my favorites that I use myself, mind-body techniques, methods such as yoga, massage, meditation, and other mind-body techniques can also result in astonishing pain relief without the use of any drugs. There are many others, and that's just 3 of the natural techniques that you can add if you're taking prescription pain medications or want to avoid them. Personally, I was on Vicodin for several years, but thank the heavens that I found this type of information years ago and am off all prescription painkillers. So what does everyone think about this? Why is there such a large number of American women getting addicted to painkillers and turning to heroin? Is it like what they said is a gateway from prescriptions and their cost and availability? Or is it another factor or something else?